All right, even in one of the coldest weeks we've had around here in years, it's not a bad idea to take a moment or two to strip down a little bit and check for moles or other cancerous, skin cancerous problems. We've got Dr. Jeff Yorio here with Texas Oncology, or have someone else do it, because it's very important.
Yeah.
And maybe as you take stock of your health in the new year, it's a good thing to do.
Definitely. Yeah, thank you very much for having me on. And it might seem a little goofy to talk about skin cancers and melanoma and protecting yourself from the sun when it's been 25 degrees outside all week, but I think it's an important thing to continue to think about. So I work at Texas Oncology and am in charge of the melanoma research program, and so definitely important for us to think about skin cancers. And I think about really two different varieties, or three different varieties of skin cancers. You know, there's sort of melanoma and non-melanomas. You know, non-melanomas would be like your squamous cell cancers or your basal cell cancers. Those tend to not be something that's going to cause a huge problem long term as far as spreading or leading to death long term. Melanoma, on the other hand, tends to be a really aggressive type of skin cancer, and that's the one we're most concerned about.
You don't know what you've got until a doctor goes in and looks at it.
That's true. So it's important to make sure and evaluate and think about what you have. If there's something concerning on your body, to take a look at it. And I usually think about 5 main things when you're trying to check yourself out, and we call it the A, B, C, D, E's of melanoma. So A means asymmetry. So if something looks a little asymmetrical on your body, get it checked out. B, the borders. If it's not smooth, if it's a little rough on the edges of that mole, you want to get that one checked out. C, color. So if there's different color changes within one mole, or one mole is extremely dark, you want to get that one checked out. D, meaning diameter. If it looks a little bigger, probably a centimeter or at least more than 6 millimeters in size, you want to get that checked out. And then last would be evolution. So if you've got a mole that's changing, that's one you really want to get checked out. And I think it's important to get a skin check with the dermatologist once a year, but really important to also evaluate and know your own body, because you're looking at it all the time, and if something's new or changed, make sure and bring that to their attention.
Yeah, we just heard a high-profile story. Pierce Morgan, who you may know from TV, recently had a viewer spot something on him, on some part of exposed skin, that they had a question about. He went and got it checked out, and that was
You got it checked out, so it was nice that a viewer caught that on the air. And so again, good for if anybody, if you loved one, friends, you notice something that's a little off, bring it to their attention. And I've heard a lot of cases. Prevention, so we always want to think about skin cancer prevention. You're probably not thinking about it a lot right now because you're not out in the sun very much, but do think about it as we start getting into the spring and summer months here. And that's, when you're out in the sun, wearing sunscreen, having UV protection. Something a lot of people don't know about is SPF, which we all think about with sunscreen, is specifically designed to attack against UVB rays, but there's the other type of ray, which is UVA rays, and those actually, SPF doesn't actually talk about UVA rays. So you want to make sure that your sunscreen is broad spectrum, covers both UVA and UVB rays, because that will help prevent long-term skin cancers, things like that.
Just be watching out for yourself, taking care of yourself, and that yearly checkup can go a long way toward keeping a bad situation from really being a tragic one.
Definitely.
All right, Doctor, we appreciate it. Thank you so much.
Hey, thank you very much for having me.
Dr. Jeff Yorio. We're going to be right back on Good Day Austin.